Next month, Houlton Regional Hospital plans to become the latest hospital in the state to cease labor and delivery services. Brittany McCatton went to the county to speak with some of the residents affected.
Thanks, John. 4 main hospitals have now announced plans to close birthing units during this year alone. The closure at Houlton Regional now leaves a labor and delivery desert stretching more than 150 miles from Bangor to Presque Isle. Both patients and providers are worried about the potential impacts to maternal and neonatal health.
At 7 months pregnant, you're so vulnerable, and there's so many unknowns. We didn't need this to be one of them.
Soon-to-be mom of two, Catherine Scott was relaxing at home last Thursday when she logged into Facebook.
I see on Houlton Regional's page that they're closing their labor and delivery unit. And I'm just, floored, right? And it was April Fool's a few days before, and you're like, is this a joke? I can't imagine that this is happening.
But as Jamie Hovey and the other 12 nurses in her unit had just learned hours earlier, the announcement was no joke.
We were all brought into a room and told that our unit was closing due to decreased birth rate. And it was very quick. They just laid it out and then left. There wasn't a dry eye in the room.
Come July, instead of a 5-minute ride to have their baby girl here at Houlton Regional Hospital, Catherine and her husband will instead have to hit the road for about a 50-minute drive to A.R. Gould in Presque Isle.
We're lucky, right? Because it's in July, so we're not going to have to deal with the snowy roads. Luckily, we have the means to have the transportation. There's a lot of people in our area that don't.
Scott and Hovey share concerns about parents traveling from more remote areas of Aroostook County and the time commitment required for any prenatal visits. Hovey isn't buying the hospital's stated reasoning, saying births are down nationwide and Houlton still sees a rate in the 80s.
That's still 80 women that need our help. That's still 80 women that deserve to have a successful childbirth.
It is troubling to see this closure in the community. It's an employer. They're providing us a critical service for young people in our community that's wishing to grow families. So that's troubling from the town standpoint, but we also understand that the hospital likely has to make challenging business decisions that we're not a part of.
The fact that this decision was made without any OB medical input just goes to show that we haven't thought this through on the adverse outcomes that can happen because of having to travel an hour north to Presque Isle or over 100 miles south to Bangor.
In a press release, the Maine State Nurses Association calls the decision disastrous for patients across the region. They're inviting members of the public to attend a town hall on the planned closure of the labor and delivery unit. The meeting is scheduled for tomorrow night at 5:30 at the Miller Civic Center. Now, our media partner WAGM did speak to hospital officials today about the decision. We have a link to their story on this topic on our